some really fantastic questions from the viewers on the YouTube channel. Anita asked the question, will hormonal birth control affect my emotions?
There's potential side effects, and can your mood be affected? It can. Is it for most women? No. I mean, most women actually do great with any form of contraception. But if you come to us saying that you truly feel that you're more anxious, you're more moody, you're more temperamental, on a birth control pill, it really truly could be that birth control pill. And a lot with these birth control pills is trial and error. And, you know, my line that I tell my patients, if any of my patients are watching, they know is, you know, how you do on one birth control pill can be very different than your best friend on that same exact pill, and how you do on one pill can be very different than how you do on a different pill. And so, yes, the answer, Anita, is yes, your mood can be affected. But for a lot of women, it's actually the opposite, that a lot of times birth control pills can actually help some of those mood symptoms. So, you know, it depends what we're talking about here. And that's why there is a little trial and error involved.
So another great question from one of our YouTube viewers. How does one know which kind of pill pack we have? Mono versus di versus tri?
Well, I mean, you can certainly ask your physician that. And we know it based on the name of the birth control pill, because that's, you know, every name is, to us, is mono, bi, or tri. You could also look at the colors in your birth, in the hormonal pills. You can look at the colors. And a lot of times the colors will tell you if there's 3 different colors. Now, we're not talking about the last week of pills, which are usually the non-hormonal pill. That's the week you get your period. You know, we're not talking about those, but we're talking about the other pills in the pill pack. And you can usually tell by looking at the different colors. So the monophasics, you know, for the first 21 pills will all be white, for instance. And then the last week of pills can be different colors because they're non-hormonal. But so you can usually tell based on that. But you can also ask your physician, and we can let you know that too.
So I'm going to address Alexis's question, which is a really great one in our segue. Alexis has migraine headaches with Aura. She has migraine headaches with Aura, and she had tried the mini pill, which we both, Dr. Ostrov and I, know really means the progesterone-only mini pill. And her headaches got worse. Alexis wants to know what other options she has.
So there are other forms of contraception. They're only completely non-hormonal. If your neurologist is telling you completely non-hormonal, other than barrier methods like condoms, the only non-hormonal option out there is the copper intrauterine device. So IUD, intrauterine device. The copper IUD is our non-hormonal, and then we have hormonal progesterone IUDs. These are devices that are placed in the office. They only take a few minutes to place. In general, I promise you, patients do fantastic with the insertions. They really do. I mean, my patients impress me every single day. They do great. So in general, women with migraines with Aura can use these progesterone IUDs. I don't specifically know the caller's situation and what her neurologist said, but in general, migraines with Aura or contraindications to estrogen, you still can use these progesterone IUDs and use them very well.
Yeah, I agree with that. And there are a lot of clinical situations that we run into where we know that a progesterone-containing IUD, and you pointed out pelvic pain, endometriosis, patients with adenomyosis, which is endometriosis in the lining, in the wall of the uterus or the muscle of the uterus, those patients benefit greatly from the hormone or progesterone-containing IUDs as a primary modality for managing some of those painful conditions, and they're certainly better than birth control pills. And certainly if somebody has an underlying condition such as migraines with Aura, then those are really fantastic to use in those patients. Another YouTube viewer asked us a fantastic question. The hormonal or non-hormonal IUD is better, and I'm not sure there's a really great answer for that. And I think it's tailored towards an individual's needs and how they feel, and whether or not you know, one of their big interests is pain, endometriosis, decreasing the heaviness of their periods. Is that your general sense of the matter?
Well, they're actually pretty equal. So they're both going to be over, just like the implant in the arm, they're both going to be over 99% effective in prevention of pregnancy. So as far as better there, they're actually quite equal. As far as better at controlling your periods, well, you know, it depends what we're talking about. If you still want to see your own cycle intervals of if you get a 28-day cycle or 30-day cycle, well, the copper IUD may be better for that because it's not affecting your cycles. But if you want improvement in the number of days of bleeding, potentially the flow of your cycles, and potentially the cramps, well, then probably the progesterone IUD is better. So it just depends how you specifically are defining better, which for every woman is a different definition. And that's why I truly enjoy having these conversations with my patients in the office. So I understand what their goals are of their form of contraception.
Another great YouTuber question. Morgan asks a question: can I use the IUD for that fantastic contraceptive benefit, but then also take the pill for the cycle control? What do you think about that, Dr. Ostrov?
You don't need to be doing both of them. Now, with that said, sometimes for women that are using, say, a progesterone IUD that are experiencing a lot of abnormal bleeding, sometimes we will give them a different hormone to help control some of that irregular bleeding for a short term to see if it helps. But in general, no, I think you should feel comfortable with your one form of contraception. And it's very rare. I don't think I've actually, in the last decade of practicing, that I've ever had to do the copper IUD, a birth control pill on top of a copper IUD. I don't think I've actually ever done that. I guess you could, but I would say that may be a little overkill.
So someone asked the question: if you do the arm implant or the shot that's in the muscle, what effects does that have on the muscle mass? And I think I can help kind of answer that fairly quickly. The shot is in the muscle, correct? But the implant's not in the muscle. The implant's actually below the skin, above the muscle. So I think the answer is 0 for 2. There's no effect on muscle mass for any of these. It's just like any other depot type shot that you put, and it gets absorbed over time through the vessels that go through the muscles. So this has been Women's Health Weekly. Thank you very much, everyone, for your fantastic questions.
Yes.
We really appreciate them. We really appreciate your feedback. We really appreciate Dr. Nikole Ostrov from Maiden Lane Medical, and you can reach us at maidenlanemedical.com. And I hope everyone has a really fantastic Memorial Day weekend. Stay safe and healthy, and enjoy.